We are here with Dr. Gail Rousseau, the Chief of Surgery at the Neurologic and Orthopedic Hospital of Chicago. Today's discussion focuses on football-related head injuries. Why is there such interest in this problem right now?
Well, I think there's been a lot of media attention, especially this week, because the NFL released a study looking at its older players that showed that there was an increased incidence of dementia in players who had spent a career in the NFL as they move on in life. We've also had local tragedies with high school players who've had not only concussions but second impact syndrome, who've become very sick. So I think there's a real effort being made on the part of athletic trainers and neurosurgeons to try to get the word out about how to prevent, recognize, and treat football and sports-related head injuries.
And how big a problem is this?
Well, actually, it seems to be a growing problem, big and getting bigger. About 10 years ago, it was estimated that there were about 300,000 sports-related concussions every year in the United States. In the last year, that's estimated to be 3 million. So it's increasing remarkably as more and more young people in particular are participating in sports. So of course, the message to responsible adults is how to prevent these injuries and how to recognize them when they occur.
What is a concussion exactly, and how do you define it?
Well, that's really a good question because the answer to that has really changed over the last 10 years. We used to teach and be taught that a concussion by definition required a loss of consciousness. And it turns out that a better way to define concussion is simply any interruption or change in neurological function as a result of a blow to the head. What that means is that only about 10% of injuries that occur to the head result in loss of consciousness. Only about 10% of concussions are actually obvious because there's been a loss of consciousness. It's just a much bigger field and much bigger problem than we had once recognized.
And how would a coach or parent know if a concussion has occurred?
Well, it's important to be familiar with the typical warning signs, and those can be confusion or clumsiness. Sometimes it's a behavioral change with irritability. It may be a matter of simply forgetting what happened during the actual blow to the head, the play that caused that, or what happened immediately before or immediately afterwards. And certainly if there is a loss of consciousness, however brief, that would be a concussion as well.
And how do the responsible parties make return to play decisions?
Well, that's something that we're working hard on. One of the things is to recognize those warning signs that I just mentioned. The other is to involve the player and question the player about, do they have headaches? Do they feel mentally slow or dull? Are they noting troubles coming up with memory issues that they never had before? Are they having trouble with concentration? Are they having a change in their sleep pattern? So this combination of things that can be observed by coaches, athletic trainers, and parents, as well as the player's own symptoms, things they can report, are helpful. But probably the most help is being provided by a program that was really developed for the Pittsburgh Steelers by my neurosurgical colleague, Joe Maroon. Over 15 years ago, Dr. Maroon, who's been the neurosurgeon for the Steelers for many years, was faced with a decision for an athlete about whether to allow him to play in the big game against the Cowboys the next week. And his sense was that he shouldn't play. Yet there was no data available that would suggest or underpin Dr. Maroon's decision to not want to permit this athlete to play. And since that time, we've made great headway by the development of a program called Impact, which is a software program that is now available and is used in all of the NFL, in Major League Baseball, in World Wrestling, and a large number of contact professional sports, and increasingly in high school sports. And it's a very simple concept. The idea is that you test response times, memories, symptoms in athletes when they're well at the beginning of a season, and then retest them immediately after they've had an injury. And based on whether there's a significant change from their healthy responses and response times, that gives some science to a decision about whether to return to work or to play.
And is there anything else you want to say about concussions?
Well, of course, although we're understanding more about how to recognize them and how to treat them, as with any other type of trauma, the best treatment is prevention. So in football, of course, helmets are required. But this is not only a problem in football sports. It's estimated that among every 100,000 high school athletes, 47 football players will have a concussion, but 36 soccer players will have a concussion too, and they don't wear helmets. And then even going beyond organized team sports, if we think about a sport that the general population enjoys, like bicycle riding, that is the most common sport to be involved in a head injury. So what we know about bicycle riding is that only 40% of cyclists wear their helmets, and yet 85% of bicycle-related head injuries could be prevented by the simple wearing of a helmet. So the message is, wear a helmet for your sports whenever you can. Wear a helmet biking whenever you bicycle. And just be careful. If you are injured, be sure that you get expert advice about evaluation, treatment, and return to work and play decision making.
Great. Thank you so much for your time.
My pleasure.